Hello, my name is Maggie Wolfe, and I, along with Julieta Garcia, Casey Winkleman, and Eva Alpar, will be presenting on voice care for non-musical occupational voice users for World Voice Day. So, I would first like to talk about who is at risk for voice disorders. We may think that this is only people who use their voice for a living, such as professional singers or professional actors, but there are actually many other types of professions that require a lot of voice usage. So 10% of U.S. workers are heavy voice users, and these professions will include lawyers, teachers, clergy, receptionists, waiters, and other people in the service industry. And teachers among these professions are actually very high risk for developing a voice disorder. Around 58% of teachers report a history of voice disorders. But unlike professional singers or professional actors, non-voice professionals are far less likely to seek medical treatment for voice disorders. And this can actually impact their ability to perform their job to the highest level. If a teacher or a lawyer or any of the other professions that I discussed can't speak very well or feels uncomfortable speaking, this is going to definitely impact their ability to perform their job. And unlike professional singers or professional actors, non-voice professionals are actually more likely to suffer chronic issues with the voice, since singers or actors are very likely to seek attention right away when a problem arises.
The most common afflictions that can affect someone's voice are, first off, laryngitis, which is the swelling of your larynx, the throat, and vocal nodules, which are hard, non-cancerous growths that appear on both sides of the vocal folds due to voice misuse. The most common causes for these voice disorders to appear are vocal abuse or misuse. And in order for you to determine if you're doing this, ask yourself, am I using my voice too much? Am I speaking too loud constantly? Do I yell or scream too much? These are all possible forms of vocal misuse. Another reason could be acid reflux. A diet with irritants can create the stomach acid to travel up the esophagus and into the pharynx. The acid might cause mild to severe damage to your vocal folds and your throat in general. Along with this last cause is dehydration, which may cause your larynx to get too dry. Viruses or bacteria can enter the larynx and infect it along with the vocal tract. There could be some hormone imbalance that may be causing changes in size, shape, or swelling of the vocal folds. And of course, one of the main factors for severe damage is smoking, which we highly discourage in order to keep a healthy voice. Now you must be wondering, how do I know if I am misusing my voice? Well, these are the signs. The best ways to identify vocal disorders caused by vocal abuse are pain. Is always a red flag when something hurts while speaking, swallowing, or drinking. Hoarseness of your voice, huskiness, having a breathy or whispery tone, cracking, which is what happens a lot when teenagers are growing, especially boys, and they have cracking of the voice. But if you're not in this stage, there might be some damage if cracking appears, and constant necessity to clear your throat.
The National Institutes of Health organized their vocal hygiene recommendations into three broad categories: hydration, healthy diet and lifestyle, as well as proper usage of the voice. This first category, hydration, may sound quite simple. Basically, it entails drinking enough water, which can be anywhere from 6 to 8 glasses a day. I know what works well for me is to just keep water nearby and drink whenever I feel thirsty. But another thing to consider when you're trying to stay hydrated is avoiding dehydrating substances, such as alcohol, caffeine, and certain medications. Our second category is healthy diet and lifestyle. Now, first, it's important to eat a proper diet and avoid foods that might trigger acid reflux or GERD, such as spicy, salty, fatty, and acidic foods. Also, it is important to get regular exercise, which not only promotes respiratory health, but can improve muscle tone for better control of posture and therefore breath. It's also important to get adequate rest, avoid smoking or being around secondhand smoke, and just to practice general good hygiene to prevent illness. This includes washing your hands frequently and wearing a mask when necessary. Now, our final category is proper voice usage. So first of all, it's important to avoid voice overuse. Now, this might be hard to categorize for non-vocalists, but in general, I would recommend listening to your body's signs that it needs rest. So if you're feeling any sort of discomfort, don't push it. Next to consider is avoiding vocal extremes. So this can mean extremes of range, speaking in a very high register or very low. If these aren't comfortable for you, you might find that you're pushing, which can create tension and also cause damage, as well as shouting or screaming or whispering in excess. Also, it is important to avoid noisy spaces because you will often overcompensate by increasing the volume of your voice and using additional amplification whenever possible so that you're really not compensating with your throat. Now, there are a few things with regards to proper voice usage that actually can be learned from the hygiene habits of singers. Now, the first is using adequate breath support while speaking. The second is speaking in a suitable and comfortable register for you. And then the third is adding vocal warm-ups and warm-downs to your daily routine.
Now that you know how to take care of your voice by just watching what you eat and drink, let's take it one step further. Let's add warm-ups and cool-downs. At the end of this little section, I'm going to have a few examples for you that you can try at home that are going to help you preserve your voice for the long run. So let's go ahead and start with warm-ups. Similarly to how an athlete were to warm up before any extraneous exercise, so too does a singer need to warm up their voice before singing. But why? What exactly does this do for the singer? Why is warming up so important? Well, among other things, 3 things in particular improve when warming up before singing. 1 is going to be an increased pitch range. 2 is going to be smoother transitions from the lower to the higher voice, as well as 3rd, improved ease of singing, which as singers is something that we strive for. We want to make everything look absolutely effortless when we are singing. But what about people who don't sing? Are warm-ups important for, maybe someone who talks on the phone all day? Absolutely, yes. Even during regular speech, multiple muscles are working in tandem to create the sound of the human voice. And warming up those muscles is going to be super important, especially if you have a job similar to what we were talking about before in the beginning of this presentation. So let's go ahead and move on to cool downs before we get into any examples. A lot of focus is always put on warm-ups, making sure the voice is ready to go for any extraneous exercise. But cool downs are just as important. At the end of the day, when you've been talking a lot, you want to make sure that you bring your voice back down into a normal rate of speech. While cool down protocols were readily made for classically trained female singers, going from their high to their speaking range, this protocol has been found to be used by contemporary commercial music singers as well, or CCM singers. And for people who don't sing, after a long day of talking, cool downs could help with overall vocal health and preservation of the voice, making sure that we're going back down into a normal way of speaking. So let's get to a few exercises, shall we? We're going to do one of each, one of the warm-ups and one of the cool-downs. Obviously, you can see I have a few up there that we won't be able to get to, but let's go ahead and try some out real quickly. Let's try the sirens on the warm-up side. This is one of my favorites. On a lip trill, this is, for those of you who do not know, a lip trill looks like this. And my lips are just vibrating together. So, a siren, go ahead and try this along with me. We're going to go from the lower part of our voice all the way to the top and back down to the bottom. So go ahead and try it with me. And obviously you don't have to go as low or as high as me, or you could go lower or even higher. The point of this is to just get your voice ready for the day. You can also do this on raspberries, which look like this. Or even on an open vowel. Some nice fun stuff like that. Experiment with it, have some fun. Now on to some cool downs. One of my favorite ones is to just hum, sliding through the top of the range, almost like a roller coaster, kind of similar to how we were doing the sirens. So, taking a good deep breath in, go ahead and try this with me. And all of these other warm-ups and cool-downs you can try at home, experiment with them, and just have some fun. Here are a few resources that my colleagues and I use throughout this presentation. We really hope you enjoyed, and we hope you have a wonderful World Voice Day. Thank you so much.